I was 31 years old and I realized that something was going on because I started to experience just kind of like some focal seizures is what they're called, and I started to have some visual disturbances, and I was getting lost in my own house, getting lost on the way home from the grocery store. Just things seemed off as far as directionally. So I went into the emergency room, and that's whenever they told me that I had a brain tumor. So I found Dr. Clough, who was my neurosurgeon, and I had my first surgery in August of 2003. And in 2007, I was given Timidar, which is a form of chemotherapy. After that, I found out again that the tumor was growing in 2013. So I underwent another surgery. It started to grow again. So in 2014, I had external beam radiation as well as a form of chemotherapy. It was not a pleasant thing. I experienced everything that they told me I was going to experience. Extreme fatigue, of course, the dreaded hair loss, and that was probably the worst part of it, to be honest. They told me at the very beginning that there would be some hair loss, but I had no idea how much. And I can remember looking in the mirror and crying because I was pulling out clumps of hair. And last year, 2019, again, found out that my tumor was growing back, and my doctor told me at that time, Dr. Clough, that he had a new therapy that he'd like me to consider. Instead of like external beam radiation, he wanted me to try this new form of radiation. So he told me at that time about GammaTile, which I was just fascinated by because I couldn't imagine just this little white, tablet looking thing with radiation beads in it. And it really just targets the areas that need to be targeted and leaves the rest of normal brain tissue alone. He said that there'd been a lot of good success with it and not really have any hair loss, etc. I was very interested. I was told that I would be the first patient in Kansas to receive GammaTile therapy, and actually at that time I was 1 out of 11 in the country to have received it. So that kind of made me jump on board too, because I definitely wanted to be a part of helping other people. Dr. Clough and I have been together through this entire thing. He's done all 3 of my surgeries. I've always told him, I'm like, next time can you just shave my entire head if you're gonna shave the back of my hair because it takes so long to grow out. So this time I thought I'm gonna play a joke on this guy if I'm gonna have to go underneath the knife anyway. So I went to a barber shop and I shaved in my hair, cut here, inside the back of my hair. And apparently he thought that was pretty funny. I asked him later on what he thought. He was like, well, I'm glad that you gave me instructions. I knew exactly where to go. I try not to take this too seriously because I just think if you do, you're just setting yourself up to be kind of depressed about it or whatever, and that's not me. So try and look at everything with a, happy face. So coming out of the procedure, I felt great. This is probably the best recovery I've ever had. I feel like I hit the ground running and have not had any struggles really since then. I did not experience any hair loss or any other side effects. Dr. Clough and I are both very pleased with the outcome of the surgery and the GammaTile. I've had 2 MRIs since then, and he's been very pleased with the results, and I have too. It gave me a lot of hope. Because I'll be honest, the external beam radiation experience was not pleasant for me. So just hearing that there was another type of treatment possible really gave me hope. So yeah, I think that anybody who's told that GammaTile is a therapy that they can use, I think that they should definitely look into it and consider it strongly.